healthcare data innovation with the Health Data Forum. Welcome to the Health Data Forum's YouTube channel, your gateway to thought-provoking conversations, cutting-edge insights, and groundbreaking advancements in healthcare data. Join us as we explore the transformative power of data to revolutionize healthcare delivery, patient care, and societal well-being. Embark on a journey of discovery. Delve into healthcare data through our informative videos, featuring leading experts, thought leaders, and innovators. Discover how our global movement, Data First, AI Later, is building a strong foundation for ethical and impactful healthcare solutions. Experience the collaborative spirit. Be a part of our vibrant community of health data enthusiasts, where ideas converge, partnerships flourish, and innovation takes center stage. Participate in discussions, share your perspectives, and join us in shaping the future of data-driven healthcare. Stay ahead of the curve. Stay informed about the latest developments in healthcare data through our comprehensive video library. Catch up on insightful interviews, thought-provoking presentations, and engaging discussions about the role of data as the backbone of healthcare transformation. Join us in shaping the future of healthcare. Let's harness the power of data to transform healthcare for the better. Subscribe to our channel today and become part of the Health Data Forum's mission and our Data First, AI Later initiative to make healthcare data work for everyone.
We had a visit from the former Minister of Health of the UK, so it was back in 2000 something, and he said to us that we are a very special company. So we are a private company with a public soul, and this is what we like to say, because I think this is the right way of approaching some of the issues in healthcare. So of course we need I will explain that later. So we always put first clinical and population outcomes, and then if we do that in a good way, then we will get financial results. So it's the opposite way of other approaches when it comes to healthcare, including for that research. I mean, all of our big hospitals are teaching and university hospitals, and the reason we've invested in that is because if we provide good environment and frameworks for teaching and research development, that is something that at some point is going to become or to come back to our organizations and to our people.
Fantastic, Manuel. I hope you enjoyed this introductory conversation. I think it makes it easier for us when we absorb the presentations like we did with Professor Shirley Wang. Manuel, I think we are ready. The floor is all yours. I hope you enjoy the presentation.
Thank you very much. Because I'm going to be more comfortable this way. So as I told you before, so for us, we consider that we cannot provide good healthcare or good outcomes or excellent outcomes if we not have the right data to do that. And that means not reactive or prospective data, but also what is going to happen. This is an example, a real example of one of the value-based contracts that we are running in Spain. So the most or the oldest one. And you can see here that we are managing around 500,000 people, and we know exactly what is happening to each individual that is in that contract on a regular basis. This information is updated every night, so we know which patients are in different layers of care, so the utilization level, the drugs, and also, as you can see, some proactive or predictive approach in terms of unplanned costs or frailty or other risk assessment. So this is key, and this is key because we keep asking this question to ourselves every single day. This was published in 2020, and so the answer or the conclusion of the article was not very positive because basically we are facing everywhere the same issues in terms of healthcare. And what are those issues? What issues are basically the ones that you can read every single day when you open the new paper. So here, this is a collection of headlines of Spain, of the NHS, of Portugal, of Central Europe, basically saying almost the things that you have in mind, that we have waiting lists, that we have an aging population, that we have costs that we cannot manage, that the way we are financing, that we are paying for healthcare services probably are not the best, or are not the most updated way, that we have chronicity, that we are going to live more. That's very good for us, but not for the system. And also something that is quite new, that's interesting because we usually say that living more, so it's a bad thing, but not it's really a good thing. The problem is that we need to make that sustainable. And also that's important, that's something quite new after the pandemic. We have lack of talent. So there's not enough doctors or nurses to provide the right care or the amount of care that we are going to need. Also, very, very, very interesting and very important. This is, for me, probably the critical part of how the system is structured and why we are struggling providing healthcare. If we think on a, let's say, diabetic patient, which is a classic example of a chronic patient. So probably if we stick to the left, so to the traditional way, so we are not going to have integrated system, so the patient should or can go to primary care. She or he is going to get 2 or 3 blood tests there, but if she or he is getting worse, she should go to the emergency department, where she's going to get another blood test. But if she's getting even worse, she's going to be admitted, and probably she's going to get, or he's going to get, another blood test. And with his discharge, nobody's going to tell the primary care doctor that the patient has been in the hospital admitted for 2, 3, or 4 days. That's not efficient, as you can see. Even if you put that on the other way of the coin, so that is not good for the patient. We are not providing the right care. The right care is what you see on your right. Yes, on your right, yes, which is basically that what we need to change, what we need to share, what needs to be moved in the system is not the patient, is or are the data, what needs to travel. So when I go to the primary care, the results of that blood test should go to the doctor in the hospital or in the emergency unit, not the patient. And that's because we are still, I think, we are still managing hospitals and doctors like in the 19th century. We still think that we have that kind of society, and that with that approach, which is basically having everything in all the places and working as a silos, we can provide the health that we need for these people, which is what we are right now. We are healthy people, that we are going to live longer, that we are a little bit more or well educated, that we have access to new technologies, and that we are demanding a different way of providing healthcare. And that's the layer, the basis of the healthcare is being set by the big ones. So we expect to receive a care from healthcare similar in the way we receive a package from Amazon, or the way we interact with Netflix. That's the way we want to have access to healthcare. So for that, we have like 3 big ideas that we've been implementing in our contracts, which are these 3 main pillars. The first one is clinical management, and that's, I've told you something in advance, which is basically that what we want to have in first option always is health outcomes. This is what we prioritize. When we invest, when we think in what we want to have in that department or in that hospital, it's always improving health outcomes. So for that, we use promotion, data, integration, coordination between levels, sharing data, platforms of federated data. So we can improve year by year or period by period the health outcomes of the population, basically in three main areas. Of course, clinical outcomes in terms of value and healthcare outcomes, outcome results. The second is accessibility, so we can reduce or maintain under control the waiting list. And the third idea is patient experience. So it's also very important that we could keep people satisfied with the healthcare they are receiving. The second part, which is the one in the middle, which is human resources, that has become critical for us. We think that we are a company of people that take care of people. So if we not provide the right environment to our people, so if we do not provide them the right research, the right support, the right data, the right environment, that is not going to be the best option for us to provide better or good outcomes to our population. The last, and probably this is the most interesting part, it's technology. And I will speak about technology in these three main areas. So we have three big areas of technology that we've developed internally in our company, that we have that in our operations, in our hospitals and primary care centers, which is basically the first one, which is it's like an electronic medical record, but we prefer to call that a platform. It's the tool that we use to make sure that we have data quality in the point of care. So the tool that we allow or that we help doctors, nurses, researchers to register, to track, and to record the data that they use on a quality moment. That's the first thing. The second, which is in the middle, it's a patient portal. Basically, the way the patient interacts with the system, so we can get there the prompts and the prems of the patient. The last one is the data federated platform that we call Sinara Intelligent, which is basically it's a BI, it's a powerful data lake where we can extract data in real time than the one you've seen before, and which is basically this. This is an example of that data federated platform. And we can use this data in different ways to make sure that we keep patients, individual patients, and we provide individual and fully personalized care to each patient or citizen, because also we consider that patient, it's a word that for us it's too late, means too late. So we prefer considering our members or the people we treat as citizens. So because we are a health provider, a healthcare provider. So we also work and we also promote well-being and health promotion. So also this is an example of how data can help us providing this kind of solution, which is exactly knowing which patient or which citizen is in each layer of needs of care, so we can track and promote exactly a specific care plan for each one of them. So we have, like Kaiser Permanente, you're probably familiar with Kaiser Permanente. So we have the what we call the Ribera Salud pyramid, which is 17 different layers of care. So we divide or we stratify or we select or we put our patients, our citizens in different 17 different layers of care. So from patients that they are good, so they have no disease, which is about 40%, between 45% in our contracts, to those patients in high cost and high needs. And depending on that, we can allocate different strategies, different clinical strategies. From those patients that they are healthy, so we provide them full digital access to the system. So they can chat with the primary care doctor, they can chat with the nurse, they can ask any kind of questions. Of course, they can request an appointment, to those patients that, of course, they need a special care. So that means, of course, they can be in the hospital, but also we have a fully remote hospital at homes digitalized units. So they can be at home and they can also have all the support or all the umbrella, the support umbrella of being in the hospital. So I have a video that is, I don't know if it's going to work. I think it's not going to work. It's not going to work well. So this is a video. I will share that with Paula, and they can, because it's on YouTube. It's basically the population health management approach of the company, which is exactly what I've been trying to explain. So we say that the care should be first data-driven care, second based on a population approach, predictive, personalized, and also proactive. So we do not want patients to come in the hospital. We want to go, or we are going to see if the patient is okay, it's fine. We want to track them, and we want to know if that is going to work. And last but not least, the question is probably, but that is working. I mean, you are providing better results. You are financially viable. That is efficient, so that the patient experience it's better or not. And I have some slides that can at least prove with real data that is actually working. This is an example of a contract that we were running in Spain. And when we integrated primary care, I mean, when we were managing the hospital at the moment, but when we start also managing the hospital and the network of primary care center, and we provide that things that I've shared with you, which is technology, which is trained human resources with these clinical pathways and integrated data federated platform, that is what happens, which is basically we start, or people started going less to the hospital, to the primary care, to the emergency department, and being treated and being attended in the primary care centers, and not going to the hospital. Another example is this one, which is so better healthcare outcomes in terms of diabetes or flu vaccination coverage in our contracts compared to the public sector. And that's all. And just to finalize, I would like to share two things. The first one, it's quite obvious. I mean, if we are continuing managing the healthcare the way we've been doing in the last 20 years, we're going to obtain the same results. That's quite, you can see that from Harvard, but also from the common sense. So if you do not change something, so you are going to have the same outcomes. And I have three recommendations or three big ideas that we think that are going to be like the tipping points or the key factors for the futures. The first idea is that we still think that healthcare is provided in the hospital, but that's not really the truth. So the future is going to be something more decentralized and defragmented. Healthcare is everywhere. It's going to be everywhere in the future. The second part, it's about value-based healthcare. So we should start or stop financing healthcare in terms of quantity. The more we do, the more money we get at the end of the month. That's not good from a healthcare perspective. So we need to start thinking in different ways of financing healthcare. The last but not least, it's about federation or collaborative healthcare, and that includes also social care, nursing homes, and other parts of the healthcare. So thank you very much.
citizens in order to provide better health care and better interventions to promote their health. There should be some kind of, let me pull the topic to my field, public health information system that could gather all this information and that could link between healthcare providers, researchers, political deciders, that we can all see the benefits and the important effect that real-world data can have in every one of our aspects.